Hi, I'm Carolyn. I'm a personal trainer specialising in exercise after cancer. What we're going to do today are a series of movements that are appropriate and helpful for people to do after they've had breast cancer surgery. This is not including women who've had breast reconstruction, that's a separate film, but this is for anybody who's had lumpectomy, local excision or a simple mastectomy and surgery in the armpit, in the axilla. Starting place is to do a little warm up, and we're going to shrug the shoulders up and gently bring them down. Gently up and down. Importance is that this shouldn't hurt. None of this, you'll get a sense of maximum movement, but there shouldn't be any pain here. When you're learning to do exercises post-surgery, it's important to become really familiar with what's okay for you, what feels all right, and then to learn, it's a little bit of an art to it, but to learn how to get so that you move as much as possible, but within the realms of what feels reasonable and comfortable to you. So we're shrugging the shoulders up to as far towards the ears as you can and bringing them as low as you can, but temptation is to kind of bring your neck down, whereas what we're trying to do is simply use the shoulders to come up and down. So however feels right for you today. What you may well find, if you do this in a mirror, you may find that one shoulder moves more than the other, and it probably did before surgery, let alone after. So don't worry about that. Then we're going to circle the shoulders. So gently, I'm doing a movement that's coming backwards first and then underneath. A little bit of grinding in my shoulder blade that I can feel. And again, it might feel that one side wants to move much more than the other. Might be that you can feel this, particularly on the backward movement. You might feel this, you might feel a different movement around the chest muscles where there's been surgery, but very helpful to do. I'm doing exercises that my physiotherapy team taught me post-surgery, and I have to say they've been really, really helpful. So hopefully you'll join me. From here, we're going to bring the hands to the shoulders, bring the elbows up gently. You can do this with drains in. I did it with drains in, and my hunch will be you will be advised to do this from the early days. We're sitting tall if we can. Hold your tummy muscles tight but gently tight. Try and keep your back nice and long. And again, what we're doing is we're focusing this movement just on the shoulders, bringing the elbows as high as is reasonable, but if here's enough for you today, then fine, just go as far as feels comfortable. Cool, we're now going to take the elbows out. Now again, you may well feel this on the chest muscles, might feel it a little bit along the arm here. Again, if you still have drains in, you can tell which side my surgery is and I keep pointing at it. If you had drains in, these are perfectly safe to do, don't worry. Might be worried about them moving, but they're well held in. So we're bringing the elbows as high as feels comfortable, lowering them back down. Good stuff. We're going to bring the arms behind. It's as if you were trying to fasten a bra behind you. So we're going to bring the hands up towards the shoulder blades and back down. Again, go as far as you can, don't force it. Whatever feels reasonable for you to do today. Cool. And then we're going to bring the hands towards the temples. Now it might be that to get your fingers here today isn't doable, in which case hands towards your shoulders, or even down here for what you need, but it's a different direction of movement that we're aiming for. So we're going to try and bring the elbows together, gently, gently, as much as you need, as I say, with your elbows, with the tops of your arm as high as feels right for you. But what we're trying to do is remind the body how to bring the elbows towards the middle and then back out. Go as far out, so as far back as you comfortably can, but again, if it feels too much on the shoulder, on the chest muscles, then you just do what feels right for you today. So that little routine I did in a hospital gown. I did it straight away, and that's what my physios taught me to do 4 or 5 times a day, frequently, within reasonable elements of comfort. But the deal is if you can find a way to do it regularly and consistently, then it pays off. It pays off in terms of shoulder mobility, in terms of how much of a pull you feel along the arm and into the armpit. It's worth the time investment, particularly if you can, to do it from the start. So that's level 1. And continuing, if you're more than a week beyond surgery, and specifically if you've had your drains out, we can move on a little further. But what I would do is that routine, shrugging and circling the shoulders, bringing the elbows up, bring the elbows forward, bringing the elbows round this way and up the back. I would use that as a warm-up routine for the future, so that you remind your shoulders how to work moving on. So if you've got cracked that and it feels okay and your drains are out, what we can then start to do is this, and we're going to clasp the hands together. Try and, it's not a silly thing to say, try and relax your shoulders rather than having them up here, and we're going to bring the arms up as high as is a reasonable ask. Now, post-surgery, it might be that that's going to be only to here or lower. It's whatever feels right for you, but it's as high as your arms feel able to go. My surgeon told me my surgery was on this side, and his suggestion was I used my non-surgery arm to lift the other. Feels a little bit different, feels quite comfortable, but the idea is you're going as high as is reasonable, and you'll get more mobility, you'll feel it. If you can stick with this for a few days, few weeks, you'll feel the benefit. So we're bringing the arm up and over. You could do this lying on a bed, by the way. Gravity is a little bit different, and you might find that you move a little more, so you can lie flat on a bed. Bring your arms up and over if it feels you can. Another one that we can do once the drains are out, I'm going to demonstrate it on this arm so you can see me, is to stand next to a wall, but at right angles to a wall. Have the hand on the wall towards shoulder height, and then we're going to stretch the arm up as high as is reasonable and back down. Different movement, different angle, if you like, different way to be asking the shoulder to move for you. And again, in terms of stretch under the armpit and into the biceps, triceps, along the under edge of the arm, you'll feel that. What we've also got, again, it looks similar but will feel different. We're going to face the wall, have the hand around shoulder height on the wall, take it straight up, bring it back down. Okay, reaching as high as you can, coming back down. So week 2, week 3, I'd go to this point. I went to this point. Frequently, multiple times a day if you can. Don't overdo it, don't hurt yourself, because it's not worth it. And that one more. So we've always established that here, moving the elbows forward is helpful in week 1. Instead, we're going to see if we can bring the elbows back. So again, fingers around your temples, if that's a reasonable ask, and it's to bring the elbows gently back as far as you can. Again, feel a stretch across the chest muscles. What we're trying to do is persuade the shoulder blades to move back towards each other if they can. Doesn't need to be a lot of these, 5 or 6 should do it. Your muscles will tell you when they're tired, and they will definitely tell you when you've moved them far enough. So that is week 1 into week 3 of shoulder mobility exercises for people who've had breast surgery.